Well, first of all, we don't really see in childhood cancer that early detection is as big an issue as in adult cancers. And the reason is that childhood cancers tend to disseminate early. That is, they tend to go other places of the body early on. So it's very hard to really pick them up when they're very, very early in their course, like you do with adult cancers, which take a little longer to disseminate in general. But there are some things that you can look at. I mean, if a child develops bruising, bleeding, looks anemic, is having fevers, that sort of combination usually means that there may be something wrong in the bone marrow where the blood is made. It may not be leukemia, it may be something else, but it's certainly a group of symptoms together that one would say, I better take my child in and have them looked. Certainly if they develop an expanding lump, an expanding mass, either internally that's obvious to the family or externally, that's something that should be seen by a doctor. The other thing I think that is important are things like persistent nausea, vomiting, and headache, particularly early morning. That's a sign of potentially of a brain tumor. Again, not exclusively. And then someone who has persistent abdominal pain, to me, that deserves being looked at. I mean, it's not just pain one day or a couple days, but persists. That deserves to be looked at to be sure there's not something going on. Again, it may not be cancer, but it's something that deserves to be looked at. It may turn out in some cases to be cancer.